Hi, everybody. My name is Ryan McIntire. Our project is over patient-reported outcomes of firefighters using 7 health and ability questionnaires. I worked on this project along with Connor Howard, Haddon McIntosh, Rileigh Ricken, and Dr. Jennifer Volberding. First off, I've just got a PowerPoint slide over my poster. I'll go into detail of these, and it's more difficult to zoom in at a time, so I just went ahead and made a full slide set for us to view. Okay, on the background, firefighting is among the most dangerous professions due to their exposure to toxic environments, unstable buildings, difficult body positioning, among many other factors. These injuries can be costly due to medical bills and the related need for time off for the affected firefighters. Departments also incur costs due to the nature of firefighter injuries, often occurring while working, and the need to find replacement firefighters. Patient-reported outcome measures provide insight to the participant's perceived health state, which is beneficial in providing more individualized catering to treatment and prevention of adverse health outcomes. Our goal was to obtain a state of the union, so to speak, of a local fire department by administering 7 different PRO measures related to functional mobility, pain, and health-related quality of life. Our methods. Firefighters were evaluated using 7 health questionnaires adapted to online formats using Qualtrics online survey software. We used the foot and ankle ability measure, disablement in the physically active scale, inertial phase rating scale, Oswestry low back disability index, patient-rated tennis elbow evaluation, quick dash outcome measure, and the RAND 36 measure of health-related quality of life. As a general summary, these surveys inquire about mobility of body parts, perceptions of pain generally and locally, whether pain is associated with certain activities, and how potential dysfunctions or injuries are affecting the firefighter's quality of life. For our results, I've went ahead and combined everything into a table. Here we have a table of some of the more significant results from each PRO measure. Using the DPA, 14 of the 35 firefighters answered slight, moderate, or severe for the pain and motion variables. The overall score found for the DPA was 12.63 out of a possible 64 with a standard deviation of 11.51. For the PRTEE, the total score for the left arm was 6.77 out of a possible 100 with a standard deviation of 13.91, and the total score for the right arm was 6.80 out of a possible 100 with a standard deviation of 11.70. Only 2 of the firefighters indicated stiffness or soreness after activity on the inertial phase rating scale. The frequency of minimal disability, 0 to 20% disability, was 91.4%, 32 of the 35 firefighters via the ODI, and the other 8.6%, 3 of 35 firefighters, answered as having moderate disability, 21 to 40% disability. The mean for the ODI was 3.97 out of a possible 50, with a standard deviation of 3.82. The perceived function percentage reported by the firefighters on the FAAM had a mean of 96.03 out of a possible 100 with a standard deviation of 14.74. The quick dash total score for the firefighters was 15.06 out of a possible 55 with a standard deviation of 5.04. The firefighters' mean rating for the energy fatigue category via the RAND 36 was 54.14 out of 100. For our discussion and conclusion, the findings from our 7 different health questionnaires administered to the firefighters indicated a general presence of pain, impaired motion, and soreness. The SF-36 also showed a potential issue with the firefighters' level of energy and fatigue. From our results, we recommend fire departments utilize health questionnaires such as the ones in our study to further identify issues, as well as use the questionnaires as an indicator of change in health state of their firefighter populations. Combining administration of health questionnaires with aerobic and core strength exercises may show improved health and fitness of firefighters and reduce costs related to firefighter injuries. Thank you for listening. These are our references, and if you have any questions, you are welcome to contact us. Thank you.